Hello everyone. So today let me briefly explain about different modes or routes of transmission of hepatitis B virus infection. So hepatitis B virus can spread from one person to another person through different modes. So first one will be parenteral route. So hepatitis B virus is one of the very important blood-borne pathogens, which means it can transmit through blood and blood products during transfusion. So it is very important to screen the blood and blood products before transfusing from one person to another person. And also it can transmit through needle prick injuries. So this more oftenly occur in healthcare individuals who will be handling the needles. If they are pricking the infected person and by mistake they got pricked into their hand, they can acquire the infection. So that's why hepatitis B vaccination is mandatory for all the healthcare individuals. And this hepatitis B virus can also transmit by inoculation during surgical procedures, dental procedures, or percutaneous inoculation during shaved razors or toothbrushes or during tattooing. So this hepatitis B virus can also transmit during these procedures and through the equipments. And hepatitis B virus compared to HIV and hepatitis C virus, this virus is highly infectious. Even 0.00001 ml of blood can be highly infectious. And the next mode of transmission will be sexual transmission. Following unprotected sexual contact with the infected individual can transmit the hepatitis B virus into another healthy individual. So homosexual males are at high risk. So this sexual transmission of hepatitis B virus is commonly seen in developed countries, whereas parenteral mode of transmission is commonly seen in developing countries. And the next mode of transmission will be vertical mode or perinatal transmission, which means transmission of infection from mother to the fetus. So if the mother is a carrier of an infection, this can transmit to the fetus. The transmission can occur at any stage from pregnancy to delivery to breastfeeding. The risk will be maximum if the mother is hepatitis B pre-core antigen positive, because at that stage of the infection, the virus will be highly multiplying in the body as well as it will be highly infectious. And the last mode of transmission will be direct skin contact. So having direct skin contact with the infected open skin lesions can also transmit the virus. So if the person is infected with hepatitis B virus and also he is having open skin lesions, and another person who is coming in contact with these open skin lesions of the infected person, that healthy person can also acquire the infection. This is about modes of transmission of hepatitis B virus, which is very important for 3 marks for all the exams. Thank you.